This video, recorded from a head-worn camera, shows a healthcare provider getting a syringe ready for medicine. In this example, a powerful sedative known as propofol is properly labeled, as you can see in the text flashes. But in this staged example, using different medication, there is a mismatch in the label placed on a syringe. What you're looking at is an AI system attached to the camera that is flagging the error in real time.
So the goal is really for patient safety.
Artificial intelligence is increasingly ingrained in our lives, and it could soon play an important safety component in the ICU or an operating room by preventing medicine errors.
We know that the medication from the vial to the syringe, it's possible that things could get switched up and then the patient could get the wrong drug. And this is important because maybe it could be a drug they're allergic to.
Dr. Kelly Michelson is an associate professor of anesthesiology at UW Medicine. She and her team researched how effectively AI can alert any mismatches in the drugs they're about to give to a patient.
People make mistakes.
Sham Golagora is a professor at UW's Paul G. Allen School of Computer Science and Engineering and co-authored the study with Dr. Michelson. He thought about using AI while considering some grim numbers. An estimated 5 to 10% of all drugs given are linked with errors.
So the question we asked is, can we have an additional pair of AI eyes looking over and trying to do an additional check to make sure that the drugs are being given correctly?
Their research published in the NPJ Digital Medicine in October shows their AI achieved 98.8% specificity at detecting vial swap errors. They tested the AI algorithm while recording staged mismatches plus large amounts of data in the OR until eventually the program was trained to find discrepancies.
So it ultimately just uses all the visual cues of the vial or the syringe. So it looks at the color, the text, the orientation, the size.
Still, they had to find a way for the AI to recognize labels even when they're partially covered by, let's say, a hand, or if the lighting is dim. Through machine learning, their AI program was indeed able to find mistakes.
The way to think about it is, even, for example, you're buying a cereal, and even if half the words in the cereal are covered because of let's say you're buying Cheerios, and let's say CHE in the Cheerios are covered because someone has their hand on it, you can know the context of the colors around it. You know that the last few words are iOS, and you basically know that it's Cheerios, right?
The camera system has only been used for research and is not available in market. No details yet on how the errors would alert the provider, whether it's a beep or a visual cue through special glasses. The first step was to prove the AI can work.
Of course, having another person standing there rechecking is kind of a cumbersome solution. So using AI to do this automatically in the background, I think, is a really neat solution.
For HealthLink, I'm Christine Pei reporting.